tell you, there's a medical plantation out there, and it affects my people. The same people who came off the plantation after 1865 are now being used to harvest disease. You know, just as there is a industrial prison, criminal justice complex, there is a healthcare complex that makes money off of certain populations in chronic disease. Yep. And it feeds off ignorance. Well,
it's interesting you mentioned that too, because like one of the, when you go into look who's buying organic and all this frou stuff, it's really rich people, and it's not that dynamic of foods, but the most processed things, the macaronis, the whatever, right? Fast food, that is what is available to lower social economic classes.
Right. So we call those food deserts. And we call a lot of these features basically social determinants of health. They are things that we realize now are more predictive of your health and your disease burden, more so than your genetics, more so than the color of your skin. There have been several studies done. You can find most of this stuff on the web now, that your zip code in the United States is more predictive of your disease state, on your health state, more so than your genetic code. That being said and done, we saw, hey, look, man, we've got to be revolutionaries. We saw this has been done before in history. So we're like, hey, we got to make a difference. I can no longer make profit off of the disease that's being basically sown and reaped in my people. So in the same way that Gutenberg's printing press freed people as far as education, we decided to create a health literacy movement where we can actually free our people. Once upon a time, the church had this centralized repository of knowledge and information. When Gutenberg started printing out the Bible, people were like, oh, shoot, I can read this for myself. We realized that freed people in their thought and their being in a relation. The same thing happened when you taught the African slave, allowed him to read in America. Frederick Douglass and the like led a charge. We realized that all throughout that once people attain knowledge, they actually free themselves. So we're like, how can we do that? Well, there's been tons of ways of done it. It's been done in the past. Each way in America has been actually choreographed to music. It was the Negro spiritual with the abolitionist movement in the early 1800s. In the 1920s, it was the Harlem Renaissance and jazz. In the 1950s and 60s, it was soul music and the Black Power movement that led the civil rights movement. In the 1980s, it was actually hip hop and the resurgence of the HBCU and college education in the African American community. In the 2000s, it is emergency medicine remix and health literacy. So we have now taken the most potent marketing tool invented in our time, hip hop, and now actually rolled it into health literacy. And we blended the two to get this new drug out there. The new drug is information. The new drug is data. And we're actually pushing that in this same urban hand-to-hand street model that made Jay-Z popular, that made, hip-hop a worldwide phenomenon. So that's what emergency medicine remix. We are, as they call in the streets, we are the plug. We are the source of this new drug.
Beautiful. It's got revolution all over it, man.
Yeah.